Welcome to this lecture on sepsis. In this lecture, we'll cover the definition of sepsis and septic shock, the common sources of sepsis and their presenting symptoms, the sepsis screening tool and the Sepsis 6 treatment protocol. Sepsis is a serious condition which occurs when the body's immune system overreacts to an infection. The normal immune system works to fight infection, but in sepsis, the immune system attacks its own organs and tissues. If not treated urgently, sepsis can rapidly deteriorate, leading to septic shock, organ failure, and death. Over the years, there have been many attempts to define sepsis. Until recently, we thought of sepsis as a spectrum, including severe sepsis and septic shock. By the old definition, sepsis could be identified in patients with infection and a SIRS response. The problem with this definition is that patients may have a SIRS response without an underlying infection. Or the SIRS response could be a normal response to infection. So the old definition was sensitive, but not very specific. In 2016, a group of experts from around the world came together to define sepsis. This is known as the Sepsis 3 definition. The Sepsis 3 definition regards sepsis as a life-threatening organ dysfunction caused by a dysregulated host response to infection. Put simply, sepsis is an infection with signs of organ dysfunction. In the new definition, the concept of severe sepsis was dropped, and the idea that sepsis is a continuum of badness was embraced. Most patients with simple infections, such as pneumonia or urinary tract infections, will not go on to develop sepsis. There are some patients who are deemed at higher risk, and these include patients who are immunosuppressed, on chemotherapy, elderly, or diabetic. The signs and symptoms of sepsis can be subtle, especially in the very young and elderly people. Patients may feel generally unwell. They might have a temperature or flu-like symptoms. They may be confused or just not quite themselves. Specific symptoms will manifest depending on the source. Common sources of infection include a chest infection. Patients may present with shortness of breath, a productive cough, and discoloured sputum. An infection of the neurological system, such as meningitis, where patients may present with reduced consciousness, confusion, a headache, or neck stiffness. Gastrointestinal infections often present with diarrhea, vomiting, and stomach cramps. In urinary infections, patients will often complain of pain or discomfort on urination, frequency, and lower abdominal or back pain. Skin infections will present with warm, red, and swollen skin. There are also a number of intra-abdominal causes of sepsis, such as cholangitis, appendicitis, and bowel perforation, all of which require surgery. It's important to think carefully about the probable source of sepsis so we can use the right antibiotics to target the most likely microorganisms. Sepsis UK have been working to increase the awareness of the signs and symptoms of sepsis with a series of high-profile campaigns. But why are we working so hard to improve the way we diagnose and treat sepsis? Well, every year, 150,000 people in the UK will develop sepsis. Of those, nearly a third will die. That means that sepsis kills more people every year than breast cancer, bowel cancer, and prostate cancer combined. And yet, our understanding of sepsis in the general population and amongst health professionals is poor. Sepsis UK recently launched their campaign to encourage people to just ask, could it be sepsis? In hospital, we screen for sepsis using the red flag sepsis screening tool. Signs are related to systemic hypoperfusion, hypotension, tachycardia, confusion, increasing lactate, tachypnea, and hypoxia. These signs are screened for using the sepsis screening tool. You may see these on the wards and in the emergency department. If red flag sepsis is present, immediate treatment must be started. The Sepsis 6 must be completed within 60 minutes. This includes starting oxygen to maintain saturations above 94%, taking blood cultures and a blood lactate, starting IV fluid resuscitation and IV antibiotics, and measuring urine output hourly. Importantly, antibiotics must be administered as soon as possible when sepsis is suspected. The choice of antibiotic will depend on the source of the infection and the local antimicrobial policies. There are special protocols for sepsis of unknown origin and for neutropenic sepsis. Sepsis can deteriorate into septic shock, which is extremely serious and carries a mortality rate of 40%. Septic shock can be identified in patients with sepsis who have been adequately fluid resuscitated but remain hypotensive. They'll require vasopressor support and have a lactate of above 2. Sepsis is a time-critical condition. For every 1 hour delay in initiating treatment, the mortality increases by 7.6%. NICE have published a series of guidelines which aim to recognise and treat sepsis early. A key component of this is completing the Sepsis 6 treatment protocol on time. Compliance with the Sepsis 6 bundle has been shown to reduce the risk of death by 46.6%. This means that if we improve the delivery of the Sepsis 6 within 60 minutes nationwide, we could save 14,000 lives every year. We still haven't found a perfect solution, but together we're working towards saving lives of patients with sepsis. The Sepsis UK campaign across the country raises awareness of the signs and symptoms of sepsis and aims to improve the procedures that we have in hospitals. In summary, sepsis is a life-threatening organ dysfunction caused by a dysregulated host response to infection. Septic shock occurs when a septic patient has been adequately resuscitated but remains hypotensive. Importantly, they'll still need vasopressor support and have a lactate above 2. The sepsis screening tool is used to screen for the signs of red flag sepsis. And the Sepsis 6 treatment protocol is used in the treatment of septic patients. It includes 3 things in, that's oxygen, fluids, and antibiotics, and 3 things out, blood cultures, a blood lactate, and hourly urine output. Completing the Sepsis 6 treatment protocol on time is associated with a reduced risk of death of 46%. Thank you for listening to this lecture on sepsis. You can find more information about sepsis and septic shock at the Trust Hub pages and go to the Department for Sepsis. You can also find some really useful resources on the Sepsis UK website.